The elderly are among the 9.4 million people the government hopes to vaccinate against COVID-19 under the second phase of the National Immunisation Programme. There is an urgent need to get this group vaccinated as Malaysia battles rising COVID-19 mortality. A majority of the victims are the elderly. We asked consultant geriatrician Professor Dr Shahrul Bahyah on how best to address vaccine hesitancy among seniors and expedite vaccination for this vulnerable group.
If you were to look at the Malaysian population as a whole, I think probably only 10 to 11 million have registered for MySejahtera, and I will probably hazard a guess that a small proportion of that would be the elderly. And looking at phase 2, how it's been rolled out, I think it's been well coordinated in most centres, but it's to try and get the elderly to come forward is the issue. And I think there is up to about 20% dropout in that they don't turn up or they withdraw because there have been, a certain hesitancy on their part and lots of factual information that's being lost in social media that needs to be really focused on the elderly so that we can encourage them.
Nursing homes, she said, are most susceptible to COVID-19 infections. As such, the government should work with community stakeholders, care centres and NGOs to encourage the seniors to get vaccinated as soon as possible.
The most vulnerable are those in care homes, nursing homes, and one of the first steps would be to actually work and coordinate efforts between the government and the NGOs that support these care homes like Age Cope, etc. to, one, get these registered or unregistered care homes registered with the patients to be registered with MySejahtera for vaccination and deliver the vaccinations to the care centres, because that would actually protect the most vulnerable of the population as well as their caregivers. Second would be to ensure that the centres that are set up for the elderly in each state are well coordinated between the public health groups as well as, and it's not just up to the government, we are a community of NGOs, general practitioners, other stakeholders that need direction and coordination. And that would actually, one, allow the message to come out, get the older people access to these centres, and also allay any fears by them or their caregivers to come to these centres to get vaccinated. So there are people who are caregivers in nursing homes that have volunteered to be stationed at these vaccine centres. Some general practitioners I think they're chomping at the bits to actually help. But the key word here is coordination. And if there are many different voices that are giving information, then that can confuse the older population and their caregivers as to what's the best course of action.